Hello. My research is focused on investigating the usability and the usefulness of rehabilitation-based apps, especially for patients with a hand and a wrist fracture. So the objectives of my research is split into a number of stages, but today I'll be talking about one of the first studies I completed. And the objective of this study is to focus on what usability features affect the acceptance and the use of the apps, and how these apps can be adapted to better accommodate to the needs of the patients. The outcomes of my study are the identification of themes that can be applied to current rehab apps or future apps to improve the usability for these patients. So the NHS, just a bit of introduction, the NHS would like more user involvement, more patients to be involved in their health, and they would like to improve interventions. They would like to provide interventions which are less costly but just as effective as current services. They would like this because of they want increased patient participants so that the patients are more involved in making health related decisions and also adhering to their care more. ICT is seen as a key area with this change, which will allow this change to occur. And my research is focusing on tablet technology to access these devices, because since its release in 2010, it's become very popular, especially in healthcare for clinicians and patients. The condition I'm focusing on is finger, hand and wrist fracture. Currently, for patients to receive treatment, they're required to go to the physiotherapy clinic, where the physiotherapist gives them exercises that they're required to carry out. Then they're required to attend these physiotherapy sessions over a period of time until they're healed. Not all patients are able to attend these physiotherapy sessions for reasons such as not being able to attend, not being referred, or therefore not everyone's able to receive they're not all able to receive the care required to help them to get better. Currently, there's no medically approved systems or resources available for them to access outside the hospital to help them to manage their own health. For this study, 30 participants took part. It took place at Wexham Park Hospital in the fracture department. It was carried out in 3 stages, including a think aloud observation, questionnaire and interview. I worked very closely with the head physiotherapist at every stage of this research. For this research, I identified 3 apps that could be investigated to investigate the usability and usefulness. To identify these apps, I first spoke to a physiotherapist about the kind of exercises that were carried out. From there, I did a search, and then the ones I found, I went back with the physiotherapist and we decided on the Dexteria, the finger motion and the PTOT helper app, because they most closely match the exercises carried out by the patients. Dexteria and finger motion are more exercise interactive based apps, whereas PTOT helper is more of a reference based app. From the questionnaire, I found that 23 out of 30 participants owned a tablet device, whereas 13 of those 23 participants had to limit the amount of time they could spend using the device due to their fracture. Only 9 of the participants used the reference rehabilitation apps to aid in the recovery, and only 4 of these participants accessed these rehabilitation apps every day. These are my results. I used the computer system usability questionnaire, edited it to investigate the feelings. So after they had the think aloud observation, they were required to answer questions on a Likert scale, where they rated how well they felt each app was used. I used the Friedman test, and from there I found out which ones had the significant difference. The ones that did, I carried out a further post hoc analysis test using the Wilcoxon sign rank test to exactly where these differences occurred. From this, I can see that the finger motion app was the most accepted app by the participants. They felt the usability was better compared to the Dexteria and the PTOT helper. However, they found that in the PTOT helper, it included the most relevant exercises that could aid in the recovery. Also, just from the observation interview findings, just general things, they found issues such as button size or menu was difficult to navigate. One of the reasons they found the finger motion app one of the easiest to use was because it was very simple, and these are some of the recommendations that I found from the studies that I completed. So things like verbs to describe the exercises so that they're able to know the exercise before they click on it. The exercises should be represented in text, videos and sounds. The exercises should be medically approved. They should be more instruction based so that the users are able to follow without having to interact with the system much. And the importance of this study is the fact that this is the first study that focuses specifically on hand and wrist fracture patients, and its identification of themes to help improve current apps, and also helps developers to develop the future apps better. And also the findings from this research can be applied to similar apps. Thank you.